My name is Kira Martin. I am going to get my presentation shared with you, and then I will begin. This presentation is on breaking diversity barriers in the clinic setting. The objectives are that we're going to negate bias surrounding those with a disability. We're also going to address families who have a negative cultural view of disability. We're going to promote ethical and equal treatment for all, but we're also going to navigate diversity and cultural differences. We're also going to work on self-reflection on other potential bias and how it can hinder the quality of care. So, what is cultural competence? When we look at cultural competence, we need to have an understanding of different cultural variables and cultural views. Cultural variables exist and can vary culture to culture. These components affect interactions that we have with families and clients in the clinic. However, it can also affect interactions of collaboration that relate to our clients. So, not having cultural competence for our client is not the only issue. We also need to have cultural competence of the people that we collaborate with. Because of the effect, we need to learn appropriate responses when presented with diversity, because it does have major implications on the services that we're giving. To do this, we should explore potential barriers and the diversity we might face while working with the population that we do. While there are many areas that is important to have cultural competence about, we'll be focusing on cultural competence when it comes to family dynamic, as well as cultural views that people have regarding disability. So let's explore the ways that learning cultural competence can improve our abilities to break these barriers when it comes to diversity. Because we work in a clinic setting, we need to work on breaking down these barriers for our clients. So, sibling relationships when one child has autism spectrum disorder. The Baccaras and Grace 2009 research is the primary research article I'm going to be focusing on for this topic. They talk about the severity level of symptoms directly impacting connectivity and intimacy between siblings with autism. So, the higher their symptoms are when it comes to social skills, the more it causes challenges to connect with their other siblings. So the siblings in this study often had better connectivity and intimacy with siblings that did not have autism compared to their sibling with autism. Um, However, the oldest neurotypical child often became older sibling, even if they were younger than the child with autism. They assisted in care, they assisted in teaching ADL skills, academics, and other general skills that maybe an older sibling would help a younger sibling with. This research also showed that the child with autism often gets treated differently than the other siblings, but siblings didn't show a resentment. And this is because that they have a lifelong learning of what autism is that kids their age might not get otherwise. There were some potential issues that it's important to be aware of, that this research had a very small sample size and very similar population across the board. They came from a very similar culture and a family dynamic that was also the same. However, we need to be aware when we're working with our clients that it's not just them. We may be able to help with sibling relationships and family dynamic overall. So, cultural awareness of different views of disability. Continuing with the same research article, different cultural backgrounds do view situations of disability very differently, or any phenomenon that happens in family dynamic can be viewed differently. The families in this research wanted to normalize the family dynamic, which is why that sibling took on the role of big big sister, big brother. Um, they wanted that normal family dynamic and they treated their child with autism in a way that created normalcy for them. Another research article that's important for this is Shuttleworth and Kasnitz. They discussed cultural context when it comes to disability because each culture does view disability so different. And that is something we need to be aware of in a clinic setting because not everybody is going to have the same view of disability that we do. There are cultures that accept and value those. This is a very wide range from we accept that you have a disability, we value that your life is worthy, and we're going to do everything we can to help you, all the way to some cultures view them as almost um, superhuman and they need to be put on a pedestal and worshiped. Other cultures view it as shameful and that the people with a disability should be excluded. Furthermore, a punishment from God is very similar to the shame and exclusion, but the punishment may be on the family, that the family has done something wrong, so their child had autism, but it can also be in the past life. You did something wrong, so you were with a disability. Often they are exiled from the community or just not allowed to be around other children. It's also viewed as a disease or illness, which is very prominent in today's day and age that we're trying to be accepting and aware of autism and make people feel included. So, understanding how people view autism can help us become more culturally aware when we are working with and collaborating with families. Um, because it can also vary depending on the gender, the age, the ethnicity, the class, or the sexual orientation of the child with autism can also affect how their family views it. Um, it may be some people view that like low income, like that's why you have autism, which we know is not the case. But we also need to be aware of some of these feelings that families might be harboring so we can bring them relief, we can bring them better help, and overall be more culturally aware. Knowing the different ways that people might view a disability, starting with that view can help approach our communicate, how we communicate information and how we provide intervention. So, how can we implement cultural awareness? We need to start with being aware of our own cultural views of disability. How do you view disability? Do you think it's a positive thing, a neutral thing, or do you have a negative view of disability? Be aware of these differences in views. Be aware of our clients' cultural views of disability because it might be different than yours. Did they have a positive, negative, or neutral view of disabilities? Goes back to what we went over. How did they view it? Teach and assist with skills to help the child within his or her family dynamic and culture. So the skills that you focus on with a client needs to be relevant. The relevance depends on their family dynamic. Do they need more social skills to work in their family dynamic and with their culture? Do they need more adaptive skills? Do they need more communicative skills? Obviously, we should focus on reducing dangerous behaviors, but what skills should we target to increase really depends on the child's culture, and we need to be aware of that. The Bernier et al. 2012 article gives research on a potential genetic link. And I think this is something we need to be very aware of because it can combat cultural views. So we need to be careful not to blame a family. We can't tell them, well, yeah, it's just genetic. Like it's your genes, you're the problem. Because that can be very harmful, especially where there's not a linked gene that is completely everybody has it. Um, we shouldn't discount their cultural beliefs, so maybe they view it as a punishment from God. Well, we don't want to promote that autism is bad and a punishment. We also can't tell them, no, your belief is wrong. It's genetic. So we need to present it as a possible explanation. We need to present it as don't feel like you did anything wrong. There's a potential it is genetic, especially when they have multiple children with autism. It's not a problem with your parenting. They could share genetic makeup and a phenotype that is relevant to the autism diagnosis. Furthering on this potential genetic link is that there is support for a phenotype of autism spectrum disorder with a potential genetic correlation. And this can cause families to feel guilt or fear around having more children. Often, families stopped having children once one child was diagnosed with autism. And because of this, we need to be very careful how we present it, but we also need to be aware. If they have multiple children with autism, it's not because of anything they did wrong. It's not because of their culture. We need to make sure we don't have that bias going into it. But we also need to support families that they don't need to like fear autism. We can provide that support. One of the problems with this study does go on that so many families stop having children after one has autism. We don't know if the genetic link would differ if they continued having children. Um, we also don't know why they stop having children completely because sometimes it's not because of autism, it's because of other factors like socioeconomic status or cultural views on how many children is normal. So we need to be careful that we don't get this statistic wrapped up with other beliefs it could cause. When a person's culture and different diversity variables affect their quality of care, they experience the negative effects from bias. So we need to make sure as providers that we're not presenting negative effects of bias. And there are three dimensions in the Bulger and Jimenez Gomez study that talk about cultural competency. They had a major discussion on cultural competency versus cultural responsiveness and humility because we can't be fully competent in someone else's culture if we don't live it, if we don't experience it. But we do need to be aware, we need to have knowledge, and we need to have skill. Um, we can use these skills to better understand the challenges of family dynamic and beliefs around disability, especially when one or more children have autism in a family. So, awareness. You need to know your own bias and its impact on service delivery. So, what are your bias? We all have one. We all have multiple. It doesn't mean you're bad or evil or hate a group of people, but we all have bias. Um, Awareness arises from self-reflection and assessment. So once you're able to acknowledge that you have bias, learn where it came from. Why do we have this bias? What is fueling this bias? We need to be aware of our differences with the clients we serve because my client is not going to be exactly like my family. So I have bias and then they're different than me. If I'm not aware of those differences, I may be putting my bias onto them and my culture onto them. We also need to be aware of our social compliance. So, do we comply differently depending on who delivers a request? So, if a male parent brings a question about service to you? Are you going to respond better than if the mother brings the question to you? Because if so, you're demonstrating bias, which is unfortunately a bias I've seen in the field that a lot of people in the area I am, culturally, men are the head of the household. And that's not bad in their family, but when they meet with families that don't follow that culture, and the mother talks a lot about treatment and intervention and issues, they're maybe not as heard. Or you unknowingly go to the dad and are like, yeah, is this how you're feeling? And you're just pushing the mother's thoughts and feelings to the side based on your bias. Knowledge is also important. So, to acquire knowledge about culture is when it's specific to the people you're working with. But there is a difference between knowledge and understanding. We can't fully understand a culture, but we can seek out opportunities to learn about cultural differences. We need to request the cultural information from the client because everybody lives their culture a little differently. If you ask me and my neighbor, who live in same towns, same socioeconomic status, same religion, we're still going to give you different information about what's important to us because we're in different families. There are different things that are more important. And having this knowledge helps to mitigate the development of stereotypes and accidental stereotyping based on what you learn not from the family. So, some stereotypes to avoid that I've heard in the profession are that bad parenting causes worse symptoms of autism. If Google says this is true about their culture, it must be true. And siblings of a child with autism are ignored and forgotten. I get very shocked when I hear things like this from colleagues, and it's often like a thoughtless comment in passing, not like they've been thinking about it, they've been doing research. When a client is acting up, like having a worse day than normal, their parents must have given them something, reinforced their behavior. They're bad parents. Um, and it's really unfortunate that these are the stereotypes some of our families are facing. But having a better knowledge helps us avoid these stereotypes. Skill. So we need to obtain and use skills to provide culturally responsive care. Um, Using that client provided information to approach care takes skill. By responding to cultural cues and communicating effectively without talking down to the clients and stakeholders is a skill. Well, unfortunately, there is very limited research on evidence-based practices in the area of cultural responsiveness. This is something we still need to work on. If a family does not agree culturally with a specific intervention, we need to have the skills and the knowledge to balance using evidence-based practice with being culturally competent. I'm sure some of this has made you a little uncomfortable, like sit in your seat self-reflecting, but that's good. The more you self-reflect and think about the skills and the knowledge and the awareness that you do and don't have, the easier it's going to be aware of your bias and make change. Change doesn't happen when you're comfortable. Change happens when you're uncomfortable. So what's your bias in regards to family dynamic with autism or other issues when it comes to autism and culture? So let's take a second and look at our own cultural background and the way it shaped your view of family. Did you have siblings at home? Were you an only child? Did you go to church? Did you go to a public school or a private school? Did you do lots of outings with your family or none? Were you in a single parent home, a divorced home, or a two-parent home? Just think about it for a second. What is your cultural views? How did your background shape your view of what a family should look like? Okay. So let's dive into that potential bias. We talked about being a little uncomfortable, and this is where we're going to start making some change. So other biases I've heard are siblings of children with autism are ignored. Heard this? It's a very big movement that like the child with autism is ignored, left alone, broken. Children with autism are from low incomes. This bias shocks me. I work in a clinic. Some of our biggest donors, $1 million donors, parents of children with autism. Children with autism will not have a high quality of life. High quality, low quality, that's about what we do with it. If we ignore them and present this to them, we're not going to have a high quality. We should feel sorry for families affected by autism. I don't feel sorry for any of my parents. I feel a lot of respect. I know how brave they are, and I understand that they need a break, but I am not sorry that they've had their child. Parents don't want to listen to professionals because they want to keep their disabled child dependent. I can't even tell you how many times that this has gone around in a clinic setting. But we're not parents. Some of us are, but we're not the parents to these disabled children. Because each child is very different. Each family is very different. And I am sure that they don't want to keep their child dependent in a baby, but they also have a lot of fear surrounding doing things on their own because this is not the life they expected for their child. So, what biases did you discover for yourself? Were they any of these? Were they different? Now that we know our bias, we can combat bias because I don't want to just sit here and leave you uncomfortable. We get uncomfortable so we can make change. To make change, we combat bias. So once you're aware of your bias, you need to actively fight against it. You can't be like, that's just who I am and just what I've learned. So you need to understand how can your bias be hurtful? So think about a bias that you just came up with. I'm going to use the last one that I had up there, that parents of disabled children um, don't like, just want them to be dependent forever. I'm going to turn that on to myself. So turn your bias on to yourself. Um, Blonde parents just want their children to be babies independent forever. How harmful is that bias? How would you feel if someone said that about you? I don't want my child to be dependent on me forever. Like, that's hurtful. That's calling me a bad parent. So, understanding how harmful your bias can be is the next step. So, then you need to actively seek training, cultural humility, and responsiveness. There are many trainings on this. Um, we can continue working through this. You can do self-reflections online, and you can learn different skills to be more culturally competent and aware. Ask for feedback and hold yourself accountable. This one kind of comes hand in hand. I recommend getting an accountability partner, working with someone else in clinic, ask them for feedback, ask your families for feedback. Is there any way that I could present this better to you? Were you comfortable with this? Um, and make sure if you accidentally fall to your bias, you hold yourself accountable for that. Be like, I'm not going to do that again, and make the active changes you need to. So it's also our ethical obligation to be culturally competent. A 1.07, 1.08, and 1.10 are all ethical codes from the Behavior Analyst Certification Board, relevant to cultural competence and knowing our own. Arango and Lustig also examine the implications of ignorance and cultural contingencies and how the ethics code is not enough. It's a step, it's a piece, but we need to go beyond that because sometimes we don't know cultural contingencies of our clients because it's hard to balance effective evidence-based treatment with cultural values. So sometimes we're like, I'm just going to use the evidence-based treatment. I'm not going to ask. But sometimes we don't know what to ask. What if we don't have siblings? We might not think to ask about sibling relationships and sibling dynamics. It's also hard because we work in a science. So we're like, our science is the truth. But it might not be the truth to different cultures. They might not think that it's relevant and okay, some of our interventions. So we need to be okay with questions and attacks on what we do and be aware of, okay, maybe there are some changes I can make to make this more culturally competent because ignorance is not an excuse. And if we aren't aware of questions we should ask, we can ask other people or ask the families, is there anything else you think is relevant to your child's care? That is a very open-ended question that could get you multiple different answers, but still very important. So, continuing on cultural awareness, while family dynamic, views of disability, and approaches to bias are relevant to religions, genders, populations, and socioeconomic status, it's important to have separate awareness for individual diversities. Just like each child with autism is its own individual person, and we need to treat them individually, so is culture. Everybody's culture is slightly different. So when we start applying these circumstances that we went over, it can be helpful, but we need to make sure we're not taking a one size fits all approach. We need to individualize this to each child, each factor of their culture and diversity, because we want to be careful that we're not creating a new bias when trying to be culturally aware. So, some key takeaways. Siblings and family dynamics are important to forming a client's culture. Many people don't think of a family dynamic as culture, but it forms who they are. So it is important to regard siblings and families in culture. Culture affects how people view disability, which is something we need to navigate carefully because we can't tell them their views are wrong, but we also don't want to encourage that autism is bad and a punishment. So we need to approach the information and research they give us in a kind and respectful way. We need to understand research limitations, but also the research itself. So having research on genetics, on cultural differences is important, but there are limitations to them. Cultural information is going to be limited in research because it's not your individual client, it's a group. Genetic research has limitations. We need to remember that. So while we can have bias about different cultural variables, our own culture also directly affects our bias. So it's not just the client's culture that's important, but our own. There are different steps to combat bias and be culturally responsive. We need to make sure we're going through the steps to understand our bias, combat the bias, and start being responsive to our client's culture. We have an ethical obligation to be culturally responsive, and we should be aware of our own limitations. We don't want to fall into it's a gray area. It's okay. We need to comply with the ethics board but make sure we're not outweighing giving effective treatment is more important than cultural competence because they're all important. It's not a hierarchy, it's an even playing field, and we need to apply all ethical considerations. And these are some of the research articles that I found. I hope that in this, you were able to get a little uncomfortable and start making those changes and understanding what maybe you need to do to start being more culturally aware when it comes to family dynamics and views of culture and disability. I really appreciate that you were able to watch this, and I hope you enjoyed.